is Gary Atensi with CNTV, and today we're in Denver, Colorado. I am here at Integrative Medicine of Cherry Creek. Since 2013, this doctor has been providing pain management as well as helping you down the guiding path to a healthier lifestyle. Preventive maintenance, a big thing going on. Thanks for joining us, Dr. Chris. Let's start out a little bit with yourself. You're a native of Colorado. You grew up here in Denver, basically got your upper education with integrative physiology. You went on to become a doctor of chiropractic and even a certified acupuncture. Share with me a little bit how you got involved in this industry.
Basically, it was just because it made sense to me. You know, natural health is something that you can pretty much reduce or prevent most chronic disease through just natural health. So that's always made more sense to me as opposed to utilizing drugs or surgery. Not saying that those aren't necessary, but natural should be considered first line.
Interesting. Why do you think the need for preventive health is more important even today than it was even 20, 30 years ago when I was growing up?
Most people today, why preventative health is so important is because most people today spend their life, all of their working years, trying to work so hard, make all this money, and then afterwards, after 65 or when they want to retire, all of their savings is now going to healthcare bills. And most people are going to spend around $300,000 to $400,000 during their time of retirement just on healthcare alone. And that, to me, if you can prevent most of those diseases through lifestyle modification, such as relaxation, diet, and exercise, you're not going to need to do that. And then you can exercise well into your 70s as long as you actually take care of your body.
Interesting. I mean, it almost seems like we're in a constant battle every day. We're talking about the air we breathe, the food that we eat, even the posture of the chairs that we're sitting in all day while we're working. Are these all effects that basically chiropractic can help with?
Yes, absolutely. Most chiropractors will be able to do that. We're all trained in clinical nutrition as well as musculoskeletal management. That's why it's usually most of the stuff that is easier to help deal with.
Excellent. Why don't you go ahead and explain for the viewers out there that don't understand chiropractic, can you explain to them what an adjustment is and what takes place there?
Well, during an adjustment, what we care about mostly is joint motion. When the joints stop moving, that is where pain usually will set in. And then when pain sets in, you always will try to either avoid it through some other form of mechanics that you'll do. So what happens in the adjustment is we feel for joint motion and we encourage more joint motion again. And generally that affects the nervous system by helping decrease pain if you can get more joint motion along. Less people are probably going to need my services if they actually take care of themselves through exercise, yoga, stretching, as well as diet. They're not going to need me as much, and it's always my passion to try to get people more independently healthy as they possibly can.
Excellent. I mean, quite honestly, it's a convenient treatment. We're talking it doesn't take a lot of time, and it's really non-invasive compared to something like that of surgery.
Yes, absolutely. I mean, an adjustment does not take very much time at all when treating somebody.
One of the things that I notice here is the fact that there's a lot of symptoms out there because if somebody gets a back pain or their back starts hurting, you kind of turn to a chiropractor. But really there's a lot of other symptoms out there that chiropractic can help with. Share with me some of those symptoms that might be a red flag for folks.
A red flag as far as what chiropractic is?
Yeah, I mean, what are some of the symptoms that people have had when they walk through the doors and you're able to help them with besides just my back hurts?
Oh, lots of the other things too, especially for me personally in my practices, I do a lot of blood analysis and blood work. So when somebody's coming in and they have all of this chronic illness, I mean, cholesterol alone, if you have high cholesterol or lipid disorders, that may also mimic low back pain and, of course, degenerative disc disease. So we have to also help with their cholesterol levels, which is really going down to food management and really dietary management, and then occasionally targeted supplementation. That's just one of the examples. Other things, too, is people are tired. So oftentimes when you look at their blood, well, they're anemic or they're B12 deficient or B vitamin deficient one way or another. That's really going to help them, of course, achieve and be able to go out there and exercise, because you're not going to want to exercise if you're tired.
True. One of the things, basically, you spoke a little bit of adjustments or manipulation, if you will. What is it when you talk about extremity manipulation? That is something I've never heard before. Oh,
extremity manipulation is absolutely vital to at least the local area. So if somebody has carpal tunnel syndrome, oftentimes you need to adjust their wrist bones to really help that function move to decrease the inflammation around the nerve. Or if somebody has plantar fasciitis, you need to adjust the foot to help with that. That's where it's really going to be helped. So extremity is just limb adjusting of those bones. I mean, every joint it has to move in pretty much 6 degrees of freedom or 6 ranges of motion. And if it's not, then we have to encourage that motion to get that function.
So really it's more than just the spine. We're talking about the entire body, yet the spine is the lifeline. I mean, it really is sending all these signals to different parts of the body. How does decompression help that when we're talking about years of gravity that we're fighting against?
Decompression helping with the spine, yeah, I mean, we are fighting gravity, so if you decompress it, you're going to help at least get more liquid into your disc. The term's more imbibition, so that's how a disc usually gets its nutrients, is through decompression and actually motion. So again, if we go back to joint motion, that's how the disc is going to get more of its nutrients. And then again, of course, anti-inflammation, or just consuming anti-inflammatory foods, which the anti-inflammatory diet should just be considered real food.
Is decompression done on an inversion table, or is it done with your hands, or how does that performed? Most
of the time it's done with a flexion distraction table that we do. That will help decompress the and increase more fluid into the disc.
One of the things, like we said, basically the body's carrying these signals throughout the body. Are these electrical signals? Are these nerves? And how does electrical stimulation actually help in that way?
Oh, as far as electrical stimulation, that's just putting pads on in a local area to either help decrease inflammation or just decrease somebody in acute pain if somebody is in acute pain. For chronic pain, not necessarily electrical stim is going to be the best thing for them. Most of the time that's for soft tissue treatments, and aggressive soft tissue therapy is going to have to be provided.
Integrative Health is something that goes on here. Basically, you've got a lot of different tools that you can help people with, even that of using light. Cold laser therapy, is that something to be getting to be very popular?
Yeah, cold laser therapy is becoming to be more popular, and really the mechanism of how that's going to work is just going to increase the molecule in your body, and it's the only molecule in your body that actually does work. So if you can increase certain molecules there, it'll definitely help in healing as well as in pain.
Why did you feel it was important to become certified in acupuncture? I mean, is that something that you felt would be easily integrated with the chiropractic, and has energy work always interested you?
Absolutely. Well, acupuncture, just because there's so much research and evidence coming out for it regarding pain management, I felt it was a wonderful adjunct to my practice. So most people are going to be receiving manipulation or the spinal adjustment as well as aggressive soft tissue work, because that's where a lot of musculoskeletal pain lies. And people in acute pain is where I utilize my acupuncture particularly.
Basically what you said earlier is, folks, we don't want to wait until we're actually in pain. I mean, quite honestly, if a person gets in a car accident, they easily turn to a chiropractor. But for folks out there that don't have no symptoms at all, they're not in pain, haven't been in an accident, you're basically saying you probably want to turn to a chiropractor to maintain that health as well.
Well, I think it would just be wise to go into a chiropractor and just see what's going on in your spine. A lot of people, it's one of the more fun things for me to do in practice is giving people their first adjustment, because oftentimes we never know how awesome it's going to respond for them. But most of the time people are like, well, I don't have any neck pain or I don't have any low back pain, and all you have to do is actually palpate their spine, and they're usually crying out of tenderness. And if that doesn't tell me there's something wrong with that area locally, it definitely tells them.
Excellent. Viewers, take a look at the bottom of the screen right there. What you're going to see is his website. On the website, you can see all the different services that he provides. We've touched on a few of them here today. You can also take a look at the testimonials out there of folks that have been relieved by this type of methods that he implies here. And we're talking about located here in Cherry Creek, Colorado. And basically just their phone number. Give them a call. They can set up a free consultation with you, talk with you, decide what it is you may be needing. If you've got a lot of symptoms, or basically you just want to maintain that health. Let me ask you this, Chris. I mean, quite honestly, you take a very personal approach, a customized approach when you're dealing with each one of the patients that walk in, and they're able to directly deal with you. Is that correct?
Yes, absolutely. Everybody, pretty much when they're calling me, they are calling my cell phone, and or they get my emails and things like that. So everybody, we do not have staff here. You're always pretty much working with the doctor one-on-one, which is quite unique.
Yeah, absolutely. Are you able to provide service here in the office as well as home visits also?
Occasionally I will do a home visit if somebody is unable to. If they're an elderly patient, if they're unable to, then I am able to attend to their house.
Excellent. Do you feel this is kind of your way of giving back to the community, being able to help folks? I mean, it's got to be very rewarding to watch people who are in pain and then eventually get out of that pain. Do you enjoy that?
Yes, absolutely. Especially mostly chronic pain. That's probably the more fun thing. It's more challenging, but when you're able to combine acupuncture, aggressive soft tissue, and the manipulation, you can definitely help a lot of people in chronic pain and reduce their chronic pain, their narcotic medication, which we know is constantly a problem that we see in the media all the time.
Excellent. Last time, viewers, take a look at the bottom of the screen. You're going to see the website right there. You can also see their contact information. Like he basically says, you are dealing directly with this chiropractor, which is really unique nowadays. And you're talking about being able to access him right to his cell phone. Come on the office and they can sit down with you and discuss what it is you may be needing. That is Integrative Medicine of Cherry Creek, located right here in Denver, Colorado. This is Gary Atensi with CNTV. And if you don't know, now you know.